Welcome to our graduation. Welcome to our celebration. Like all aspects of our lives in the era of COVID, this graduation speech is a little different. It's not live. It's recorded virtually in my garden on Fire Island, as you can see. It's without my regalia, which are at my home in Newark, and is with this haircut. And also with this not far from me. This not far from me. But this very close to my heart. Graduates, I hope you will take this time to reflect on all that you have accomplished, all that you have achieved in reaching this point in your lives, and the significance this accomplishment holds for you and your families, and for your faculty, and for your teachers, and for us as a school. You should be particularly proud having navigated the complexities of the last few months as you concluded your studies. This moment is just also an incredibly significant one for me as your dean at the School of Public Health. Many of you began your studies as I was beginning my tenure, and over the last few years, we have all worked with intelligence and with gusto to grow our school in prominence and in stature. More than anything else, we have grown the relevance of our school as we collectively work to enhance the well-being and the health of people in New Jersey, of the country, and of the world, to the unofficial motto of our school, which is keeping the public in public health. There is no doubt that throughout your studies, all of you have engaged in discussions about the social determinants of health, how society and numerous other contexts and collectives such as families, neighborhoods, and communities play a pivotal role in either protecting or undermining the health of people and populations. The idea of social determinants is relatively new. At the beginning of the 1900s, efforts in public health were focused primarily on pathogens and infections and spreading disease, and rightfully so. This was an era prior to antibiotics, antivirals, and vaccinations. And here we are again, challenged by a novel virus with no treatment and no vaccine. Over the course of the last century, our scientific advances have, for the most part, empowered us to control infectious disease. We must bring the same skill, intelligence, and resilience in managing COVID-19. But as you know, COVID-19 is more than just a virus. Yes, it can infect anyone, but as with many other diseases, those who are most impacted are marginalized in our poor communities, often communities perpetuated and impacted by social inequities. The facts speak for themselves. Across the country, deaths due to COVID-19 are disproportionately higher among African Americans compared with the population overall. In Milwaukee, 3/4 of the COVID-related deaths are in the Black population. And in our own state of New Jersey, over 20% of COVID-19 deaths involve African American patients, although African Americans only constitute 14% of the state population. This is because this disease is more than just about biology. Disease, and for that matter, all well-being, are shaped by social, psychosocial, and structural factors. What is required for fighting chronic diseases is a more holistic understanding than behaviors, the drivers of these behaviors, with one of the main drivers being the context in which these behaviors occur, which may lead some individuals to make decisions about risk that may seem irrational, but are the result of social circumstances. Communities of color are dying of COVID because of the economic disparities they face that burden these populations with other health challenges, and because of unequal access to high-quality care. And because too often, leaders and clinicians forget that people have complex and challenging lives, some things we never forget in public health. I've had many arguments with physicians who look with disbelief and judgment on HIV-positive patients who do not adhere to their medications. More often than not, I come back to this statement. I want you to imagine being a single mother of 4 children under 10, working 2 jobs, struggling to make ends meet, and tell me where on your list of priorities remembering to take your meds exists, or for that matter, eating properly or exercising regularly. This is all to say that social circumstances matter, and more importantly, context matters. The neighborhoods, countries, states in which we live, the places where we navigate, where we work, are highly associated with our health. In most parts of the country, social conditions in impoverished rural and urban areas create enormous health disparities in the population that live in those areas. Consider one of our state's most forgotten cities, Atlantic City. Death rates from heart disease are higher in Atlantic City than in suburban areas of the state. Not surprising, twice as many people are uninsured in Atlantic City than there are in the rest of the state. And Atlantic City residents live in poverty. A third of them live in poverty compared to 10% of New Jersey overall. So yes, context matters. Within the discipline of public health, there has also been a burgeoning literature delineating the relationships between context and health, as I have said. Beyond the extensive literature on environmental health, public health researchers have also been influenced by the ideas of Uri Bronfenbrenner's ecology of human development and have considered how context, with a particular focus on social conditions, perpetuate inequalities that drive health disparities. Such paradigms have been promulgated in the seminal work of Nancy Krieger, who delineates an eco-social model, and by Bruce Link and Joe Phelan, who describe fundamental causes as social conditions that drive disease. Theoretical and empirical work in the areas of stress research have also contributed to our understanding of the interplay of health and context. Contextual factors influence biological phenomena, and research on rats provides insight. For example, severe shortages during pregnancy have been shown to have similar lasting effects on later health in rats, suggesting that parallel processes may have the same effect on humans. The evidence for the influence on social conditions on health is robust. But one aspect that requires much more attention is how context is shaped by political conditions. In societies where politicians marginalize and oppress, populations suffer. In countries where leaders direct their efforts to benefit all and use science as a tool, the deaths due to COVID-19 have been mitigated. In my own ancestral homeland of Greece, the deaths have been minimal. The government took charge, unmotivated by political aspirations, but directed by public health. Leading researchers in public health has shown that in areas where laws are enacted to protect and uphold rights, the social, emotional, and physical health of those who live in those areas are being protected, and their health also improves. Of this idea, Harvard scientists Andrew Boozary and Cameron Nutt wrote the following, and I quote, "The health of a nation is ultimately a matter of politics. We can grimace at this fact all we want, or resign ourselves to the belief that clinicians and scientists should never wade into such matters. But the reality is that public health and politics are inextricably tied. I truly believe that in my heart. Our country and the conditions in some states offers a perfect case study of how politicians can harm health. For example, in Texas, after the legislation in Austin slashed funding for reproductive health and shuttered family planning clinics across the state in 2011, maternal mortality ratio more than doubled in just over 2 years. But for us in New Jersey, there is a very large ray of hope, with the enlightened government led by Phil Murphy and by his administration, who recognize that policies and laws do shape behavior, who recognize that research on gun violence will provide us with public health tools to overcome the endless assault on our society, who espouse the idea that a living wage is essential to make ends meet, and ameliorating this concern will free individuals to be more attentive to their health, and who acknowledge that transgender soldiers have as much to offer our armed forces as any other individual. In December of 2019, the governor called for an end to AIDS in New Jersey by 2025 and has assembled a group of thought leaders, including our own Professor Henry Raymond, to develop strategies that not only consider how powerful medications can shape this disease, but ultimately how healthcare programming, policy, access, and the eradication of stigma work in sync with antiviral therapies to eliminate HIV. You see, meds alone are not enough. And since the onset of COVID-19, public health and the well-being of the population have been directed by many of the government's efforts through public health strategies, through smart public health strategies. He and other astute, intelligent, compassionate political leaders have tried to delicately balance the health of people with economic health, and to counter the short-sightedness and irresponsibility of protesters like the ones we saw in Trenton recently. And because of the efforts of Murphy and the public health efforts of our school and others, we have flattened the curve, and the stress on the hospitals has been reduced. All the deaths were necessary, all of them. But at least they were smaller in number than would have been experienced without public health actions. Without the physical distancing ads that tell us staying in place, this would not be possible. But the battle is not over, and we all know it. You, as our newly public health leaders, will play a critical role as we continue to test, trace, and treat. In the end, a vaccine will help us control the virus biologically. But what the pandemic has shown us is that public health matters. It has always mattered, and it will always matter, because in our global world, our health rises, our health crises are sure to emerge. New ones were sure to follow. The tools and skills and knowledge you have developed at the Rutgers School of Public Health will be essential to the health of our people in our state, in our country, and our world. And these abilities should always be coupled with two core principles that define our school: social justice and health equity, critical to enhancing the health of populations. So where does this leave you? I hope it leaves you here, with the idea that your career in public health as a researcher or a practitioner ultimately will be more powerful if you function as an advocate, an activist, or work closely with advocates and activists who bring science to life, with the idea that public health is not a discipline to be practiced behind a computer, but rather in developing robust science and knowledge with populations we study, recognizing that as scientists we have much to learn from those whom we study and whose health we seek to improve as they do from us, and with the idea that laws can create enormous damage to our health, whether denying a woman the right to have control over her body, or caging young babies ripped from their mother's arms, or telling trans soldiers they don't have the right to serve in armed forces, or denying blue states the resources they need to fight COVID 19. Yes, indeed, laws and policies of this are like the microaggressions that undermine the health of people and populations. They are the aggressions. So, in closing, let me state these affirmations. We are proud of you, our graduates, as you make your way into the world, into the field of public health and beyond. And we look to you to lead the way, challenge the norms, fight for the rights of people, and improve the health of our population here in New Jersey, throughout the country, and our world. I, in turn, promise that we, your faculty and staff, will continue to build a school of public health of which you will be proud to be an alum. So, dear graduates, go out and make those dreams for a better, healthier world come true. And here are some final thoughts. Fight COVID 19, fight inequities, fight injustice, fight corrupt policies and laws, fight with all the tools we have helped you develop at our school, and also fight with your heart. And in doing so, enhance your work, and your work will be honest and true, and you will enhance and improve the well being of people and populations. This is a moment of social justice. This is a moment of activism. Let's fight this disease together. As I conclude, let me simply say, well done, graduates. Congratulations to all of you, and congratulations to those who in your life have supported you throughout your journeys. Most of all, I wish all of you good health.
Dean Halkitis, members of the faculty, students, family, friends, and distinguished guests, I am happy to greet you on this momentous occasion and to offer congratulations to all of you on behalf of the Rutgers and Biomedical and Health Sciences community. While circumstances may seem to have overshadowed your celebration, they haven't diminished your accomplishment. And though I know all of our graduates are well prepared for the situations that lie ahead, as you can see, I am not. I unfortunately left my commencement regalia in my office in New Brunswick, so I hope you'll forgive my informal attire today. I did, however, manage to dust off one of my suits to get dressed up for this occasion. Although be careful, I might be wearing a Dr. Fauci t-shirt underneath. But seriously, you will soon be graduates of one of the best public health schools in the country. You've acquired incredible knowledge and a vast array of technical and analytic skills. Skills that have never been more relevant and important to the health of the United States than they are today. Personally, I earned my Master of Public Health and Epidemiology at Berkeley, while simultaneously performing my residency and fellowship at the University of California, San Francisco. During that time, during my actual formal public health training, I was literally taught that infectious disease epidemiology was a dead field because all had been discovered. We later, of course, learned that during that exact same time period, the first cases of HIV were incubating in San Francisco. Needless to say, that teaching was misguided, and the interventions and innovations discovered during the next 10 years changed the field forever. You will not know a time in your career before COVID-19. Your work will always be informed by the reality of a crisis that just a few months ago was a mere hypothetical tabletop exercise to be scrutinized and studied. This problem is vast and complex, but as you've learned, at Rutgers, we don't shy away from what is difficult. Today, and for weeks and maybe months to come, it is likely that we will struggle against this storm at our doorstep. This is where your training will serve you well as we look to apply quickly the lessons of the theoretical to our new reality. I urge you to think big and to think across fields and disciplines. Our very survival depends on our collective ability to endure, innovate, collaborate, and support each other beyond the boundaries of typical responsibilities and capabilities. In time, I'm certain that thanks to the hard work and resilience of our united communities, the winds will shift, we will feel the breeze at our backs, and we will again look forward to find brighter days on the horizon. But undoubtedly, the hard-fought lessons you will learn during this time will be invaluable as we look forward to reform, research, policy, and interventions for a healthier and better prepared future. Now more than ever, the field of public health demands all the skill, tenacity, and innovative thinking you can muster. We will apply the theory and practice of public health for the benefit of individuals, families, communities, and society as a whole. And we will deploy our skills to inform public policy, increase the health of the population, and preserve the human dignity of everyone. I am very proud of all of you today. You have answered a noble call to serve others, and we will be the better for your dedication and selflessness. This is a great day of great personal achievement for each of you, and a culmination of your educational careers. I am very happy to be part of your day, to enjoy your success, and to share in it with your friends and your family. So on behalf of all the administration, faculty, and staff of Rutgers Biomedical and Health Sciences, congratulations and thank you.